Dear Ministry of Health representatives, partners, colleagues, chairs of the session, my name is Anastasiya Dumcheva. I am a medical doctor, public health professional, and researcher. It is an honor to be here today and present effective interventions to decrease the burden of non-communicable diseases. Before I proceed, I would like to appreciate all those who presented before me and congratulate the Republic of Kosovo with all the achievements that have been made so far in addressing non-communicable diseases. There are many, as we already learned this morning. My task today is to present to you an overview of the effective interventions to address NCDs. And when I was preparing my presentation, I thought that, before saying anything to you, I need to bring a very important message. Switch the slides. So here it is. We actually know how to reduce NCD incidence, prevalence, and mortality. Obviously, we do not know everything. Research is ongoing, new public health and clinical interventions are being implemented and evaluated. In the future, we will know even more. But now, today, we do know what works effectively. We know enough to significantly reduce the level of non-communicable diseases. Some countries demonstrated clearly. Finland, the country where I'm currently based, is a world-known example of its success to reduce premature cardiovascular mortality by more than 80%. Premature mortality meaning mortality among those who are younger than 70 years of age. This is a very important cohort for our societies, right? The cohort that actively developing our societies, contribute and build our cultural, professional, and economic goals. And thus, it is really important to keep them active and alive by 80% reduction. When I read about that for the first time, I could not believe my eyes. In fact, I thought that someone made a mistake in the document I was reading. At that time, I thought this is not possible. And actually, it is possible. Amazingly, it is possible. It took Finland more than 40 years to achieve this result. They started their interventions at the time when we didn't know that much about NCDs, and we didn't know about effective interventions in the field. They were pioneers to implement approaches that were new for the whole public health community. By now we know a lot. Any country who is willing to achieve similar results can do it. And since we know how to do it, I believe we can also do it in a much faster pace. So, what do we know? We know that NCDs have multiple risk factors, so NCDs are multifactorial. Some of them we cannot modify, such as age, gender, genetics, etc. But a lot of them, or even most of them, can be modified and can be influenced so that such risk factors are reduced or minimized. And this is important to keep in mind because for our public health section, it means that if we tackle more than one risk factor at a time, we should expect that we will improve health outcomes more effectively and more significantly. We also know that there are 5 common risk factors, such as tobacco, alcohol consumption, unhealthy diet, insufficient physical activity, and air pollution that are associated with 5 NCDs. We call them major NCDs, such as cardiovascular diseases, chronic respiratory diseases, cancers, type 2 diabetes, and mental health disorders. And again, it is important to keep this in mind because we need to prioritize our interventions to tackle 5 major risk factors so that we can effectively decrease the burden of these 5 major NCDs. We also know by now that there are 2 main strategies to reduce the level of NCDs. So first strategy is so-called population-based strategy that targets the whole population. And this is represented in the graph on the left. This strategy is aimed to decrease the prevalence of risk factors by shifting its distribution of prevalence from the high level, which you can see on the line in orange, to the lower level, which is presented in the line in green. The second strategy is so-called high-risk strategy, and this strategy targets population that has higher risk to develop NCDs. For example, patients with high blood pressure, we need to target them and treat them timely to prevent further complications. The implication for our public health action is that actually both are important, both need to go hand in hand. Population-based interventions are often more cost-effective as they prevent or delay onset of non-communicable diseases. Clinical interventions are essential for early diagnosis, timely treatment, and better outcomes. You've heard already today about best buys. I will briefly present what it means. So in 2017, WHO published a very important document. And this is the document that we call best buys. This document provided for the first time to our public health community menu of recommended priority NCD interventions. This list actually was updated this year during the World Health Assembly, so now it has the latest evidence and latest recommendation in the field. So all interventions that are effectively reduce the level of NCDs, they were categorized in 3 groups. Group 1 included the most cost-effective interventions, and this is actually what we call best buys. So interventions with the low investment or relatively low investment, produce the best results. The second group of interventions have a bit higher cost-effective ratio, but still very effective and still recommended. And there is also a third group of these interventions that do not have cost-effectiveness analysis, but they are still important and they are still recommended for implementation. At the moment, this document has 90 interventions and 22 overarching actions, out of which 58 interventions have cost-effectiveness estimates. But this is not the only document, and this is why I would like to pay your attention. There is another document that we need to know about. And this is the document about mental health. So WHO has also a document with the menu of cost-effective interventions in the area of mental health. There are also several guidelines on air quality and a comprehensive approach to tackle NCDs. Of course, as I mentioned before, they need to include all 5 risk factors and 5 major NCDs. Well, they are there for us to choose. Choose what's feasible, what's culturally appropriate, economically sound, those for which the system has implementation capacities. Priorities can be given for those interventions which expect to provide the best health outcomes based on the available evidence on risk factor prevalence and the burden of NCDs. In the next couple of slides, I will provide a very quick overview of the best buys, only those who are the most cost-effective interventions, without going into much of the details, just due to the lack of time. I would like to do it by presenting population. This is how it is mentioned here, population-based, divided by 3 groups: policies, communication, and services, and then interventions based on high risk, strategy, and this is mainly what we recommend for implementation within health services. So policies, we've heard already, and Kosovo progressed a lot, and again, I congratulate you with this. Intersectoral policies are crucially important to reduce the burden of NCDs. There are a number of them here, and again, they are highly cost-effective. Policies around tobacco and alcohol should aim to reduce accessibility, affordability, and acceptability of such products in the society through the increase of excise tax, prices, bans advertising, promotion, sponsorship, and through measures that protect people from the second-hand smoking. Policies aim to tackle unhealthy diet, aimed at eliminating artificial trans fats, reducing salt intake, free sugars, and saturated fats. These can be achieved through implementing reformulation, front-of-pack labeling, public food procurement regulations, and those that protect children from the harmful impact of food marketing. Policies to support breastfeeding is actually a new recommendation in the best buys list. This recommendation was added this year in the latest version of the best buy strategies, and they are very important for the best start in life and healthier outcomes in the future. There are also cost-effective population-based interventions that relates to policies for mental health, and they have interventions for school-based settings to reduce the level of suicide, as well as those that relate to ban of highly hazardous pesticides. There are recommendations for communication, and behavior change communication is among cost-effective interventions that encourage behaviors towards reducing active and passive smoking, promote healthy diets, breastfeeding, and physical activity. There are also recommendations for population-based services. This is not the same as clinical services. These are population-based services and aim to provide tobacco cessation services and support breastfeeding. Now we'll be very, very quick because I know that time is coming to the end. There are clinical interventions that are highly cost-effective in the area of cardiovascular disease, chronic respiratory diseases, and cancers. Please pay attention that the recommendation for cancers has been significantly enlarged. There are also clinical interventions for mental health. And this is my last slide. I would like to share, and this is based on my experience, years working in the area of NCDs, that whenever we do anything in the area of NCD, we need to consider more than just the list of recommended interventions. So those that we really need to keep in mind, and this is what was mentioned from several speakers, we need to tackle all the levels, national, subnational, and community levels. Communities are crucially important. Finland succeeded with their interventions because they started from community, they learned where the problems in communities are, and then the whole strategy was based on understanding what's happening in different levels, but communities were there. Multi-partner approach between sectors and the government and non-governmental sector, public and private, also very important. Life force approach, also mentioned by several speakers, I will not spend time. Gender sensitive. Gender plays very important role in NCDs. For each risk factor and for each of the diseases, there are different gender aspects. We need to be really gender sensitive. We need to analyze what's happening to, both genders to be effective with our intervention. As I mentioned, financial and non-financial considerations should be taken into consideration when you choose what should be implemented in the country, and we are not limited to what I just mentioned through WHO list. Countries need to try and implement interventions that fit to their culture, that they are economically sound for and feasible for implementation. And the most important, and this is my last point, and I hope this is the point that somehow you will keep in mind. Whatever you do, please monitor, assess, and document. NCD surveillance is something that is usually not very clearly understood in a lot of countries. And in a lot of countries, NCD surveillance should be developed almost from the scratch. Thank you so much for your attention, and again, very good luck for all of you.